Yes. So they, in the women's clinic, we have 9 CNMs, 9 midwives, and 4 OBs. It was a little smaller when I started, but they, one of their conditions when the 8 midwives came on was that they also wanted lactation at the clinic also. So they hadn't had it before, and had been kind of doing some outpatient in the hospital, on the birthing floor. They would see, patients that really needed to come back. So they would be doing those as outpatient, but in the clinic we didn't have any. So they didn't. There wasn't a lot of anything built in place already. So I was brought on to start it up as well. Yeah. And within about a month, I was seeing patients, which I look back and that seems pretty, it felt like a long time at the time, but looking back, it seems pretty incredible that I had an empty room to start with. And
This soon. But I was wondering, Nina, did you go out shopping? How did you get the setup started?
yeah. Yeah, so I reached out to some online like Facebook groups for lactation professionals to get other like lists of things like clinic supply lists. Um, and so I got those from a few different sources and just kind of comb through and really be thinking about like what am I gonna need here? What are my priorities? And then and not knowing quite how often am I going to need an SNS, and or a symphony breast pump. You got to make decisions about costs and things. And so yeah, so I that's kind of how I started, with just getting ideas from what other people carry in their clinic setting, and then just made decisions. So started out with the basics and then added things like a doll and a nice breast, silicone breast that I use all the time, and I'm very glad to have those here. But I'd be happy to share some of the things I use most. But yeah, I don't know how specific you want me to be.